So, in previous classes, we have discussed the pathophysiology of asthma and we have also seen the pharmacology of anti-asthmatic drugs. So, in today's class, we'll try to discuss about treatment guidelines. See, before starting the treatment of asthma, we have to diagnose the condition, right? So, anyways, for clinical pharmacologist and for clinical pharmacist, we don't have a right to diagnose, anyways, but we should know the diagnostic criteria. So usually diagnostic criteria is performed based on the symptoms of the patient, mainly based on the symptoms. And second thing, we will diagnose the condition based on the lab parameters. We have allergen tests and we have most of the monocytes and some interleukins test and all will perform in the lab. Okay. So CBC dekhte, leukotrienes we see, monocytes we see, and sometimes in asthma conditions, few eosinophils and some particularly some white blood cells will be elevated. It is not exact diagnostic criteria, but it will be supportive diagnostic test. Okay. So lab test is another test we'll perform to diagnose the condition, and we have the third one and very important test is spirometry. Okay. Spirometry, in previous classes we discussed about spirometry in detail, right? So spirometry is the sensitive test and diagnostic test to uh, diagnose that patient is having asthma. So these three are common diagnostic criteria we should know. Now you see, patient has already diagnosed with asthma, clear? Patient को already asthma diagnosed हो चुका है, and we already know that asthma is a chronic condition, and patient with asthma, sometimes asthma will be aggravating. Patient को everyday patient will not have asthma symptoms. Patient's asthma symptoms will be aggravated sometimes. Sometimes patient will be waking up in the night, and sometimes patient will be having aggravations during activities. So asthma symptoms are not persistent. They will be aggravating sometimes and they will be relieving. Relieve होते रहते, aggravate होते रहते. Okay. So see, patient is already diagnosed with asthma. So to treat asthma, we should have some objectives. Very very important. Objectives to treat asthma. ध्यान से सुनो सब लोग, ये very important है. First objective. So you are a clinical pharmacist or clinical pharmacologist. You are treating the asthma patient who is already diagnosed with asthma. First, what you will do? First objective for treating asthma is you should try to decrease the patient's triggering factors. Number one, you should try to find out which factor is triggering the asthma, and after finding that, you should try to stop that triggering factor, because it comes under non-pharmacological treatment. Okay, the first objective of a clinical pharmacist in treating the patient is to stop the patient's triggering factor. Clear? Now you see, second, why first point is important, why triggering factor is important? Because without checking the patient's triggering factors, if you keep on giving the treatment, pharmacological treatment, saba dete gaye, laba dete gaye, corticosteroids dete gaye, patient will be every time patient will be exposing to the triggering factors. So in that cases, treatment will not be effective. दवाई लेते जाते रहता patient will be exposing to the dust particles, patient will be exposing to all triggering factors, फायदा नहीं होगा. Okay, so triggering factors कम करना है. Number two, see, every time if you are giving asthma treatment, we have to make sure that patient is not getting symptoms during night and day, both night and day. During night and daytime, patient should not get symptoms, particularly in the night. This should be our second important objective. अपना objective क्या है? First, triggering factor कम कर देना. Second objective is we should try to decrease the exacerbations of asthma, particularly at night. Actually, asthma patients if they are not treated, if they are not taking any drugs, night time patient will be waking up, बीच बीच में उठ जाता, and patient will be having congestion, bronchocongestion, and patient will have shortness of breath. So patient will be having insomnia with asthma aggravations. Okay, so during night and day, symptoms should be decreased. This is the second objective. Number three, ध्यान से सुनो सब लोग, ये we have to fulfill all these objectives in our treatment strategies. Okay, and see, if you start pharmacotherapy for the patient, always try to maintain or always try to decrease the patient's adverse effects, unwanted drug reactions, unwanted side effects. We have to make sure that patient is not getting adverse effects when we start with pharmacotherapy. This should be our third objective. Okay, and see, very very important fourth objective, always treat the patient to decrease inflammation and and to increase patient's bronchodilation bronchodilation increase करना है patient में and we have to decrease the patient's inflammation. This should be our fourth objective. Clear everybody? These are the four important objectives before starting the therapy. First objective, always try to decrease the patient's triggering factor and always try to stop the exacerbations of asthma or the symptoms during night and day, and try to evaluate the adverse effects of the patient who is taking pharmacotherapy, and always treat the patient's inflammation and always increase bronchodilation. Inflammation should be decreased and bronchodilation should be increased. This should be our fourth objective. Clear everybody? Understood everybody? All these things. Now you see, we will go with the treatment strategy now. See, ध्यान से सुनो सब लोग. For treating asthma, we have some guidelines. Okay, we have very important guideline which is called GINA guidelines. सुने नाम? GINA guidelines. I think you might have heard. This guideline is very important. That I'll explain you in detail about these guidelines. GINA guidelines is nothing but, GINA means it is Global Initiative for Asthma. Global Initiative for Asthma. It is the global guidelines, and see, all over the world, if anybody is suffering with asthma, we have to follow this GINA guidelines. And for every annually, actually, this GINA guidelines will be updating. Yeah, is last year GINA guidelines will be different, and this year GINA guidelines will be different. Different मतलब थोड़ा बहुत changes रहेगा. Very few changes were made because always treatment strategies will be updating. Okay, if one drug is not effective, new drug will be added. Alternative therapies will be added. New treatment strategies will be added. And all those strategies will be added based on the researches. Recent research जो भी अच्छा निकला ना, तो with that research they will add in the guidelines. Clear? So I'll explain about these GINA guidelines in detail. GINA guideline is nothing but it is a global initiative for asthma. Okay, and I'll explain you the GINA latest guidelines 2022. Okay, and next guidelines what we have for treating asthma is we have NICE guidelines. I think you might have heard about NICE guidelines. NICE, NICE. We have NICE guidelines for hypertension, NICE guidelines for diabetes, NICE guidelines for asthma. ऐसे बहुत सारे हैं. And NICE guidelines actually it is United Kingdom based guideline. Okay, it is a government associated guideline. NICE means National Institute for Health and Healthcare and Excellence. क्या बोलते हैं? National Institute for Health and Care Excellence. Health and Care Excellence. Whatever जो भी है. Okay, so these guidelines also some countries, particularly in United Kingdom and in European countries, NICE guidelines are usually followed. And in India we can follow this. India में ऐसा following कुछ भी नहीं है. NICE, GINA, whatever, it is totally based on the physician, based on the pulmonologist. उनको जो लगे वो दे देते. And in India there are many medication errors which are seen in treatment strategies because पूछने वाला कोई नहीं है. There are no surveillance for treatments in India. Okay. And one more third guideline what we have for asthma is BTS sign guidelines बोलते हैं. BTS is British Thoracic Society करके है. British Thoracic Society. Okay, so BTS/sign is one guideline. Okay, this guideline also I'll explain you. So these three are important guidelines which are followed all over the world for treating asthma. Now we'll start with NICE guidelines. Okay, सुनो सब लोग, ध्यान से सुनो. First I'll try to give you some basic idea about NICE guidelines. Just imagine that you are a clinical pharmacist and you are treating asthma patient. So if you are treating asthma patient, how will you start your treatment? See, we have certain steps starting from step 1 to step 9. Actually 9 steps we have. Okay, initially we'll start with step 1. Step 1 is the patient who is freshly diagnosed with asthma or newly diagnosed with asthma. Step 1 किसको बोलते हैं? Step 1 is followed for the patient who is newly diagnosed with asthma. Okay, or the patient who is not started with anti-asthmatic drugs till now. So they are called step 1 patients. And in step 1 patients, if patient is freshly diagnosed with asthma, what you will do? In step 1, simply we have to start with SABA. Okay, based on the patient's body weight and based on the patient's gender and all, based on the patient's age and all, we have to start with SABA. short acting beta 2 agonist. Okay, in that levosalbutamol we have formoterol, we have both drugs. Pharmacology I'll not explain, I'll not teach in this class. Okay, previously all videos you can watch once. Stage 1 mein we have to go with SABA, right? Now if patient is not controlled with SABA, we will go with stage 2. Okay, stage 2 patients कौन है? Stage 2 patients are those patients who are not controlled with stage 1 or who are not controlled with SABA. And sometimes stage 2 patients are also considered who are freshly diagnosed with asthma, and who is having asthma, but they should be having at least 3 times, they should be having aggravations at night, in the night or in a week, in 1 week. If they are having 3 exacerbations, if they are having 3 exacerbations per 1 week, they are also considered as stage 2. आप confusion नहीं होना, simple. If anybody is not controlled with SABA, they should be treated with stage 2. And in stage 2, what we have to do? In stage 2, simple. Along with SABA, already patient was taking SABA से treatment control नहीं हुआ, तो what you'll do? You will add inhaled corticosteroid. Low dose inhaled corticosteroids will be started in stage 2. Clear? First SABA दिए, control नहीं हुआ, and now what we added inhaled corticosteroid, that is low dose inhaled corticosteroid we added. Clear? And if this dual therapy is not controlling asthma symptoms for the patient, we have to go with stage 3. ध्यान से सुनो सब लोग, ये बहुत सिस्टमैटिक ट्रीटमेंट है. These are all guidelines. In step 3, what you will do? In step 3, if SABA and inhaled corticosteroids are not controlling, along with SABA and inhaled corticosteroids, third drug you have to add. The third drug here, what you have to add is, you have to add leukotriene receptor antagonist, which are called LTRA. What is LTRA? Leukotriene receptor antagonist. In leukotriene receptor antagonist, the main important drug in previous class what we studied, mintelukast. Okay, mintelukast 5 mg 10 mg. Okay, so leukotriene receptor antagonist is added in third step. First step single drug, second step dual therapy, third step triple therapy. Now we'll go with the fourth step. If SABA, inhaled corticosteroid and leukotriene receptor antagonist is not controlling the asthma symptoms, we have to go with fourth stage. अब fourth stage पे देखो, now simple, you use common sense. Fourth stage what we have to do? In fourth stage, here along with these 3 drugs, you have to add long acting beta agonist. Long acting LABA should be added here. Okay, SABA, these three drugs are given, and fourth drug is LABA is added in the fourth stage. And in fifth stage, like this, we have to keep on. In fifth stage, we have to increase the corticosteroid dose, and we have to, what we have to do? We have to remove leukotriene receptor antagonist, and we have to add some other muscarinic antagonist. So like that, trail करते जाना. So like that, we have 8 to 9 steps. So these steps are followed usually by NICE guidelines. These NICE guidelines are not appropriate for every patient. हर एक patient में ऐसा ही देना है करके नहीं. These guidelines may be appropriate for one kind of patient. They may control with other patients. Some patients are not controlled with these treatment strategies. So always while treating the patient, initially you have to start with guideline. But if guideline is not effective, what will you do? You will trial the patient. एक ड्रग देते, उसके बाद if it is not controlling, you will go with the other drug. If it is not controlling, you will go with the other drug. So to shift to other drugs or to initiate the other drugs, you should follow these guidelines. Okay, अपने हिसाब से डोज देने का, ट्रीटमेंट ड्रग्स चेंज करने का ऐसा नहीं है. Always we have to follow the guidelines. Now you see some, I think you can just zoom the image and you see this is the NICE guideline. This NICE guideline is, for NICE guideline, see we have adults and for pediatric patients and for small children also. See, सब लोग ध्यान से सुनो. Just now I gave you the overview. Now you see, just imagine this. Can you see the image, everybody? Can you all see the image, everybody? थोड़ा zoom कर लो, थोड़ा zoom कर लो actually in this. Now you see, newly patient is diagnosed with asthma, right? And we are considering the adult patients. Patient is above 17 years. Above 17 they are considered adults. Ab adults patients में we are treating actually. We are treating the adult patient. We are checking the NICE guidelines for adults patients who are above 17 years. See here we have 2 different colors. One is dim color, that is maintenance therapy, and the second orange dark color is symptom relieving therapy. Maintenance therapy is 1 and relieving therapy is 2. When patient comes to the hospital with freshly diagnosed asthma, see, initially you will start with SABA. Single drug dete. Initially we will start with SABA. Just now I explained. And if SABA is not controlling the asthma symptoms for 4 to 8 weeks, this is first stage or first step. After first step, what we have to do? We have to go with the second step. Second step, dekho. In second step, what we have? We have started with inhaled corticosteroid. Along with this, we have SABA. SABA is continued like that only. Initially, we gave only single drug SABA. For 4 to 8 weeks, it is not controlled. Then we added inhaled corticosteroid. Inhaled corticosteroid and SABA is given. If this dual therapy is not controlling the symptoms for 4 to 8 weeks, now we will go with the third step. Okay. In third step, what we have? Along with inhaled corticosteroids, we are adding leukotriene receptor antagonist. Okay. Leukotriene receptor antagonist is added in the third step. Now, these three drugs should be given for 4 to 8 weeks. And if this is controlled, then we have to stop here or we have to continue this only. See, initially, if SABA is given, if SABA is working well, we have to continue this only. Agar ye, if it is not controlling, then we have to go with the next stage, next step, like that. Okay. Now you see, if third step is not controlling, then we have to go with this fourth step. In fourth step, what we have? We have low dose inhaled corticosteroids plus LABA here. LABA is added. LABA is added. We can either continue leukotriene receptor antagonist or we can stop leukotriene receptor antagonist. Okay. This is fourth step. I think you all are following. And fifth step, इसमें कुछ difficulty नहीं है. It is very easy. Now you see, if fourth step is not controlling the asthma symptoms, what we have to do? We have to offer low dose of inhaled corticosteroids with LABA, and we have to maintain this therapy with or without leukotriene receptor antagonist. And here in symptom relieving therapy, here you see, here it is changed. In fifth stage or in fifth step, inhaled corticosteroid is added along with LABA. Okay. And in sixth step, what we have? Same, inhaled corticosteroids, moderate doses should be given. Till now we have given only low doses of inhaled corticosteroids. Now what we did? We started with moderate doses of inhaled corticosteroids and long acting beta agonist is added. So like this, based on these therapies we have to go. Okay. And if this is again sixth step is not treating properly, then again we have to go with the seventh step. Seventh and eighth steps are the final stages. These are final steps. Agar ye those steps bhi nahi di, if they are not controlling, then we have to diagnose the condition, because agar 8th step tak if it is not treating the condition symptom, it may be improper diagnosis. Patient ka condition dusra ho sakta hai. It may be TB or emphysema or COPD or different conditions may be possible. So if till 8th step, if patient's symptoms are not relieved, then we have to shift to the other diagnostic test or other pulmonologist के पास भेजना, and we have to check again whether patient is really suffering with asthma or if any other pulmonary disorders. Clear? This is the NICE guideline. We have 8 different steps in NICE guideline, and this guideline is given for adults. I think this guideline is clear for you all. See, in examinations, second year वाले सब लोग ध्यान से सुनो. In examinations, they'll ask you, explain the pathophysiology of asthma and give the management of asthma treatment, or give the management of asthma based on NICE guideline करके पूछते. Or they will ask you based on GINA guidelines, recent GINA guidelines, or they may ask based on BTS guidelines. Okay. Or they can tell anything based on any of the recent guidelines, explain the management of asthma करके पूछते. So you can add any of the guideline. You have to write this flow chart. If this flow chart is not there, then you will not get marks. If I make question paper, I will ask like this only from asthma. Compulsory question. If I make question paper, if I have any for M.Pharm candidates or for B.Pharm candidates or for PharmD candidates, in the syllabus if asthma is there, I will definitely ask, explain the pathophysiology of asthma and give the management based on treatment guidelines or recent treatment guidelines. Okay, ऐसे ही पूछते, कहीं भी ऐसे पूछते. And these guidelines are important for competitive exams also. If you are planning for NAPLEX or for PBC and all, it will be useful for you. So, and see, we have seen the adult NICE guidelines, and now these guidelines are for patients between 5 to 16 years. Okay, 5 to 16 year के बीच patients में these guidelines are almost similar. Most of these all strategies are similar, steps are similar. We have 7 to 8 steps here, and doses are simply changed based on the patient's body weight, because in younger populations the doses are monitored properly. Okay, so this is the guideline for 5 to 16 years of aged patients. I will share all these PPTs and these images in the group. You can see these guidelines. आपको बोर लगेगा फिर ये सब. If I teach you, you will be bored. Okay, you can pause the video or you can pause and you can see the guidelines. Now you see, these guidelines are for patients who are less than 5 years. These guidelines are less than 5 years wale. If anybody is having with asthma and if their age is less than 5 years, so we have to follow these guidelines. So in NICE guidelines we have three different strategies: one for adults, one for 5 to 17 16 years of patients, and one for less than 5 years of patients. See, initially here what we have same, we have to start with low dose SABA treatment initially. If this is not controlling, then we can consider 8 weeks of pediatric moderate doses of inhaled corticosteroids along with SABA, and then this should be seen for 8 weeks. And based on the result, based on the symptoms, we have to shift to the other treatment options. You can see again inhaled corticosteroids and SABA is there, and leukotriene receptor antagonist is there, SABA is there. यही रहेंगे. Okay, this is the treatment strategies for patients who are less than 5 years. I think this slide is clear. Now you see, this is different guidelines. These guidelines is for British Thoracic Society guidelines. BTS guidelines बोलते ना, so that one. Actually this is older. This BTS guideline is older one. BTS guidelines for pediatric patients and BTS guidelines for adults patients. Okay, so these two are guidelines. These are older guidelines actually. Recent guidelines I didn't get for British Thoracic Society. I think वो अभी update नहीं हुआ है. Now you see, these guidelines are very very important. I will focus on these guidelines. Everybody should concentrate. कोई भी नहीं, you should not leave. These guidelines are very very important. In hospital you can follow these GINA guidelines. Okay, global initiative for asthma. These are followed everywhere in the world, and these are very effective, and these are very new. These are new guidelines, very latest guidelines, and these latest guidelines are based on the recent studies. सब लोग ध्यान से सुनो GINA guidelines. Okay, अब देखो. Now I'll start with the GINA guidelines with adult patients who are above 12 years. Okay, for adults and adolescents जो भी है 12, those patients who are more than 12 years, for those patients we have to follow this treatment strategy. See, NICE guideline is different and GINA guideline is totally different. Those both the guidelines are totally different. ध्यान से सुनो. See, to understand this, I'll try to explain you. See, we have two boxes here. First one is we have track 1 and we have track 2. First one is track 1. This is track 1 and this is track 2. Track 1 is nothing but it is the preferred treatment or preferred relieving treatment strategy. Always track 1 is preferred treatment and track 2 is alternative treatment. Track 2 is alternative treatment. Clear? See, in GINA guidelines we have two tracks, track 1 and track 2. Track 1 is preferred treatment, track 2 is alternative treatment. If track 1 is failed, then we will go with the track 2, which is alternative treatment strategy. Clear? अब देखो, in track 1 we have 5 steps. Step 1 and 2, step 3, step 4 and step 5. ध्यान से सुनो सब लोग, थोड़ा confusion रहता, ध्यान से सुनो. See, in track 1 is controller and preferred reliever treatment, right? See, we have two boxes here. In track 1 we have two boxes. The upper boxes are controlling treatment strategies and lower box is relieving treatment or relieving treatment strategy. This both combination is considered as track 1. Okay, in track 1 initially we'll start with step 1. Actually in this GINA guidelines, step 1 and step 2 is single only. Step 1 step 2 एक ही है. So in step 1 and step 2, what we have to start with treatment with low dose inhaled corticosteroid. यहाँ पे ध्यान से सुनो सब लोग. In GINA guidelines, this is recent guidelines. In GINA guidelines, in track 1, the preferred treatment, first and second step, we don't have SABA. ध्यान से सुनो सब लोग, we don't have SABA. फिर क्या है? GINA guideline is telling us that initially if anybody is diagnosed with asthma or if anybody is recently diagnosed with asthma, if they are having symptoms, initially we have to start with corticosteroid only. No SABA, no LABA, nothing. Initially क्या बोल रहा है? GINA guideline is telling us that we have to start with low dose corticosteroid. Clear? Both controller therapy and reliever therapy. Both the strategies, inhaled corticosteroid is the preferred treatment. Now, see, if inhaled corticosteroid is started with low dose in first and second steps, if it is not controlling the treatment, now what we have to maintain the treatment. If this is not treated, we'll go with the alternative treatment. अब ये बराबर अगर if patient is treated well with this, we will go with the same treatment with maintenance dose. Initially 200 mcg दिए, 200 mcg formoterol, and patient's treatment is controlled well, then we will follow this step 3, step 4 and step 5. If patient's treatment is not controlled here, then we'll go with the alternative treatment. Okay, see, in step 3 what we have to keep on maintaining the patient's dose. 200 mcg दिए थे, and this dose should be maintained every day. 100 mcg should be maintained to the patient based on the patient's dose, based on patient's body weight and all. And after step 3 we have step 4. If step 3 is not controlling properly, in step 4 we have to maintain the dose slightly. We have to increase the dose. Inhaled corticosteroid dose should be increased. अगर ये step 4 भी fail हो गया, तो then we have to go with the step 5. Very very important. In step 5 you see here, in step 5 they are not adding SABA. Till step 5 they are not adding SABA. SABA है नहीं. In track 1 SABA is not there, LABA is not there, so bronchodilator है नहीं इसमें. Only inhaled corticosteroids in step 1, 2, 3, 4. Dose slightly dose is increased. And in step 5, till step 5, here if corticosteroid is not appropriate, we can add long acting muscarinic antagonist. In long acting muscarinic antagonist, what we have ipratropium bromide. Okay, sorry, it's tiotropium bromide. Tiotropium bromide and ipratropium bromide, both are muscarinic antagonists only. In that, tiotropium bromide is long acting and ipratropium bromide is short acting, that we have already discussed. So along with inhaled corticosteroid, we can add with tiotropium bromide. And you can add tiotropium bromide, and along with that you can also add anti-IgE or anti-interleukin 5 or anti-interleukin 4 receptor. Okay, anti-IL4 bolte. Oh, okay, so about this interleukin receptor antagonist and all, I'll tell you. See, in the next slide I'll explain. One second. For biological therapies, we have I think in last class we didn't see this pharmacology. See, we have anti-IgE. सब लोग याद रख लो, anti-IgE. This is the older drug. In previous days it was used, and nowadays also it is using. Have you heard about omalizumab? Okay, omalizumab is the anti-IgE antibody. It is an antibody. Yeah, actually IgE, it will inhibit the IgE receptors, or it will stop the production of IgE. Okay, and second, this is first one. This is first biological agent, and second biological agent is anti-interleukin 5 or interleukin 5 receptor antagonist. Very very important, interleukin 5 receptor antagonist. And here for interleukin 5 receptor antagonist, we have benralizumab. Benralizumab. Okay, this is second biological agent. And the third biological agent what we have is interleukin 4 receptor antagonist bolte, IL4 antagonist. And here we have dupilumab. ये नेम्स पूरे याद रख लो, omalizumab, benralizumab, dupilumab. Okay, these three are very important. And fourth drug also we have the very very novel drug, new drug. It is not available in India right now. It is very important. It is very important. Anti-TSLP बोलते. Actually TSLP, these are all immune response relating mechanisms. All the mechanisms will be stopped by this drug. And the example of anti-TSLP is tezepelumab. TEZPELUMAB. Okay, so these try to remember these 4 drugs. Particularly I am stressing all these drugs because for second year students. Okay, so in exams they may ask for 4 mark questions or for 2 marks. Enlist the biological drugs for asthma. They can explain, they can ask you the question like this: classify और enlist the biological drugs used for asthma करके भी पूछते हैं. So omalizumab is very older drug and very effective drug. Omalizumab, it is anti-IgE, and for IL-5 receptor antagonist and IL-4 receptor antagonist we have benralizumab and dupilumab. Okay, and recently anti-TSLP drugs, in these we have tezepelumab. If anybody is interested in writing article, you can write the drug information. tezepelumab के बारे में लिख सकते हैं आप लोग. If you are interested, you can write this drug information. We will publish in some pharmaceutical journals. Okay, so for GINA guidelines, see, in these are important guidelines ma. In GINA guidelines, see, we have track 1 and track 2. In track 1, initially we'll start with inhaled corticosteroids, step 1, step 2, step 3, step 4, and in step 5 we are adding muscarinic antagonist, and along with that we can also add biological agents. Here in preferred treatment, SABA is not used. Why SABA? See, previously in previous guidelines SABA was there, but this is recent guideline. In recent guideline SABA is removed. SABA is not a preferred drug anymore. Why? Because very few researchers they are telling that SABA se bhi acha, initially we have to start with low dose corticosteroid. Simple. Low dose corticosteroid initiate कर दो and try to maintain that only. अगर उससे treat नहीं हुआ, then we will go with the alternative treatment. In alternative treatment, you will start with inhaled corticosteroids, and whenever SABA is required, we will start SABA. Okay. So in step 1, inhaled corticosteroid and SABA is given. This is alternative treatment. Always it is given as alternative only. And in step 2 again, same low dose corticosteroid should be maintained, and along with that short acting beta agonist is given. And in step 3 we have to maintain the corticosteroids, and if patient is taking beta agonist, we have to go with long acting beta agonist. And in step 4 same, we have to maintain the dose and we have to go with beta agonist, long acting beta agonist, but here we can increase the dose. And in step 5 in alternative treatment, what we have here, antimuscarinic agent is there and all biological agents are there along with beta agonist. This is alternative treatment. In track 1, SABA is never initiated. In alternative treatment, SABA is initiated, and remaining all treatment strategies are same. I think this GINA guideline is understood for everybody, for adults. Clear? GINA guideline समझ गए सब लोग? Okay, so this is for more than 12 years, and we have patients with 6 to 11 years. For 6 to 11 years, the treatment guideline is little bit different. Here also we have same strategy, step 1 and step 2, but here you see we don't have track 1 and track 2. यहाँ पे दो tracks नहीं है. Okay, only single preferred and controlled treatment, single track we have. In that we have step 1, step 2, step 3, step 4 and step 5. Step 1 we have to start with low dose corticosteroid and SABA is initiated here, and this is for 6 to 11 years. Adults patients में देखो initially track 1 में क्या था, SABA नहीं था, but in children in guidelines they are suggesting SABA. In children it is suggesting SABA. And in step 2 same, low dose corticosteroid देना, we have to maintain the dose. And in step 3 again we have to maintain the dose, or sometimes if patients treatment is not controlled, maintenance and liver treatment should be given. Low dose leukotriene antagonist add कर सकते हैं यहाँ पे we can start or we can't, but here we have to stop. We have to start low dose inhaled corticosteroid and leukotriene receptor antagonist. And in step 4 again same, inhaled corticosteroid with LABA or low dose inhaled corticosteroid maintenance therapy should be given, and here we have to start tiotropium bromide or leukotriene receptor antagonist. And finally in the fifth step here we have biological agents. Biological agents add होते हैं, and remaining all treatment is same as step 4. Okay, so this is the strategy for 6 to 11 years of patients. And if patients for 5 years or before 5, for less than 5 years, this is the strategy. And here also we have same strategy. For step 1 यहाँ पे देखो, step 1 के पास कुछ भी नहीं है for small children. For step 1 nothing is there here, no SABA, no corticosteroids are given, but here only reliever is given. Step 1 के अंदर we don't have controller therapy, we have only reliever therapy. So SABA is given. अगर SABA से control नहीं हुआ तो then we'll go with the step 2. Okay, this is recent guidelines. These are all recent guidelines. यहाँ पे step 2 में क्या है, corticosteroid is added. Okay, and you may or may not add leukotriene receptor antagonist. Step 3 same, corticosteroid should be slightly increased, and inhaled corticosteroids and leukotriene receptor antagonist should be given, and SABA is continued always. Step 4 में continue the same treatment. Here you can add inhaled corticosteroids and long acting leukotriene receptor antagonist, and you can treat according to the condition. So this is for children के अंदर difference क्या है, you see just difference. Okay, These are different guidelines for treating asthma. GINA guidelines are very important. I will share these three slides to you, particularly for second year students. You try to write these guidelines in exam. अब देखो, I will give you one case now.